it is hard times right now for us. We have had to let some employees go throughout our system over the last 3 months. But the truth is, the sisters have always had to stop one ministry so that they can be ready to accept the next. And when times are tough, and communities throughout our system are going to lose their health care because their one and only hospital or clinic is going to become insolvent, it is our job to be ready. But if you can't inspire people to think about their world in that way, as I try to connect with the nurse at the bedside who's saying, you won't even buy the best equipment for us, or we don't make the most money, or why can't we have more staff? Trying to help and support the nurses at the bedside in trying to understand the greater organization isn't easy. And communication is probably the hardest and most challenging part of my job. Every day I think about the days that I was at the bedside in a very, very busy ICU. How would I ever have wanted to receive information from my broader employer, that is the nurse leaders who expect me to communicate with them, when I had 2 or 3 acutely ill patients in the ICU and almost no time to get a computer, and we had staff meetings maybe once a month? How would I have wanted that? And I don't know. So my job is to spend enough time in the field with a lab coat on rounds to ask, to say, how can we help you feel informed? How can we translate very complicated, detailed information so it's there when you need it? Thankfully, technology gives us those tools if we can just figure out the right technology with the right recipient. And the other side of this is, my other big communication challenge is how to help nurses be the same courageous, not outspoken, but certainly assertive men and women that those Sisters of Providence were. If you kind of look at the history of sentinel events, those things that are reported to the Joint Commission over time, 70% of really bad things that happen to patients are somehow connected to communication. Somebody didn't communicate right, somebody didn't communicate at the right time, somebody wrote a bad order, who knows why, 70%. Of those 70, 40% of them, a nurse knew something. A nurse. So how do I help get information out that's important, whether it's clinical information or financial information, or did you know these things are happening in our system, or did you want to participate in this mission opportunity? But how do I also teach, expect, and hold accountable nurses so that that 40% never happens? So that the new graduate from your program who's only worked in the operating room for 6 months has the support and the courage to stop when it's time to do a timeout because it didn't happen right, and to say, we need to do this right before we do anything to this patient right here, to make sure this is the right patient, getting the right surgery on the right limb at the right time, and that all the people on the team know what they're there for, and no errors will be made. And that's probably tougher work. I think some of the problem thinking really about servant leadership is, well, the way we have coped all these many years is going harder and faster. If we just go a little bit faster, we can do more for our patients and get through the day and not crash and burn. And actually, sometimes doing what I think of as the timeout, that is, whether it's in the operating room or in anywhere else, is to stop and think about, why am I here? What really matters? Who do I serve? And what do I need to express? How do I communicate to my peers, to my colleagues, and most of all, to this fragile, vulnerable patient in this bed and his or her family? So to me, I've always thought of communication as fun. That was what I used to do in many other jobs. But in this one, it's everything. It's how you, the words that you use, how you connect what you say with what you do. Because at my level, I can say anything I want. Anything I want, and people say, oh yeah, that's right. But if I don't walk the walk that reflects what I say, then I have no credibility.